Hello, wonderful English learners. Welcome to Daily English, the friendly place where you can improve your English through simple, practical, and natural listening practice. My name is Erin, and I'm very happy to be your host today. Before we begin, take a slow breath with me. Breathe in, pause, breathe out. Much better. Today, we are learning something extremely useful: English at the doctor. Have you ever visited a doctor and suddenly forgotten every English word you knew? The doctor asks, "What seems to be the problem?" And your brain says, "The problem is everything?" Maybe you know your symptoms in your own language, but you do not know how to explain them clearly in English. Or perhaps the doctor speaks quickly, uses unfamiliar words, and asks several questions at once. Do not worry, you are not alone. Many English learners understand medical vocabulary when they read it, but during a real appointment, the conversation can feel fast and stressful. The doctor may say, "How long have you had these symptoms? Have you taken anything for the pain? Does anything make it better or worse? Are you allergic to any medication?" Those questions may sound difficult when they are spoken naturally. Today, we will practice them together. You will learn how to explain your symptoms clearly, describe pain, talk about how long you have felt sick, answer common medical questions, understand fast, natural doctor-patient conversations, and ask the doctor to repeat or explain something. We will also do listening exercises, repeat after me practice, and one complete doctor appointment conversation. By the end of this episode, you should feel more confident speaking English at a clinic, hospital, or pharmacy. So grab a notebook or simply listen carefully, and let's begin. Let's start with the word symptom. A symptom is a sign that something may be wrong with your body. For example, a headache is a symptom. A cough is a symptom. A fever is a symptom. Feeling dizzy is a symptom. Let's repeat some common symptoms together. A headache. A stomachache. A sore throat. A cough. A fever. A runny nose. Back pain. Chest pain. Nausea. Dizziness. Good. Now let's explain a few of these words. A headache means pain in your head. A stomachache means pain in your stomach. A sore throat means your throat feels painful, especially when you swallow. A runny nose means liquid is coming from your nose. Not the most beautiful description, but very clear. Nausea means feeling like you may vomit. Dizziness means feeling unsteady, weak, or as if the room is moving. You may say, "I feel dizzy," or "I've been feeling dizzy since this morning." The phrase, "I've been feeling," is useful because it describes something that started earlier and is still happening now. For example, "I've been feeling tired." "I've been feeling sick." "I've been feeling weak." When the doctor asks, "What seems to be the problem?" you can begin with "I have," "I feel," "I've been having," or "I've been feeling." Let's look at some examples. I have a bad headache. I feel very tired. I've been having stomach pain. I've been feeling dizzy. Notice the difference. We usually use I have with a noun. I have a headache. I have a fever. I have a cough. We use I feel with an adjective. I feel tired. I feel weak. I feel nauseous. I feel dizzy. Now let's talk about pain. You can say, I have pain in my back, Or, my back hurts. I have a sharp pain in my chest. I have a dull pain in my shoulder. A sharp pain feels sudden, strong, or like something is cutting or stabbing. A dull pain is less intense but may continue for a long time. You can also describe pain as burning, throbbing, aching, cramping. Let's repeat: burning pain, throbbing pain, aching pain, cramping pain. A throbbing pain often feels like repeated beating. For example, I have a throbbing headache. A cramping pain often feels like the muscles are tightening. For example, I have stomach cramps. Now imagine the doctor asks, where exactly does it hurt? You can answer, it hurts here. The pain is in my lower back. The pain is on the right side of my stomach. It starts in my neck and moves into my shoulder. Sometimes our bodies decide to create a complete mystery story. The pain begins in one place, moves somewhere else, and refuses to explain why. But the clearer you describe it, the easier it is for the doctor to understand you. Doctors often ask, how long have you had these symptoms? This means, when did the problem begin? You can answer, for 2 days, for about a week, since yesterday, since Monday, for several months. Notice the difference between for and since. Use for with a period of time, for 2 hours, for 3 days, for 1 week. Use since with a starting point, since this morning, since yesterday, since Monday, since last month. Let's practice. The doctor asks, how long have you had the cough? You answer, I've had it for 3 days. The doctor asks, how long have you felt dizzy? You answer, I've felt dizzy since this morning. You may also need to explain whether the symptoms are constant or occasional. Constant means they do not stop. Occasional means they happen sometimes. You can say, the pain is constant. The pain comes and goes. I only feel dizzy when I stand up. The cough is worse at night. The pain started suddenly. The pain developed slowly. These small details are very useful. Now let's focus on listening. Doctors and nurses may speak quickly because they ask the same questions many times every day. You may hear, what seems to be the problem? Spoken naturally, it may sound like, what seems to be the problem? It can feel like 6 words have become one very long word. Let's practice slowly first. What seems to be the problem? Now, naturally, what seems to be the problem? Again, what seems to be the problem? Good. Another common question is, how long have you had it? Slowly, how long have you had it? Naturally, how long have you had it? Repeat, how long have you had it? Another question, have you taken anything for it? Slowly, have you taken anything for it? Naturally, have you taken anything for it? The word you may sound like ya in fast, informal speech. Another question is, does anything make it worse? Slowly, does anything make it worse? Naturally, does anything make it worse? You do not need to understand every individual sound. Listen for the important words. Anything, make, worse. Another common question is, are you allergic to any medications? This means, does any medicine cause a harmful reaction in your body? You can answer, no, I'm not allergic to any medication. Or, yes, I'm allergic to penicillin. Never guess when discussing allergies. If you do not know, say, I'm not sure. Now let's practice a complete conversation. I will perform both the doctor and the patient. First, listen without repeating. Doctor, good morning. What seems to be the problem? Patient, good morning. I've been feeling unwell for the past 3 days. Doctor, what symptoms are you having? Patient, I have a sore throat, a cough, and a mild fever. Doctor, how high has your temperature been? Patient: It was about 38 degrees last night. Doctor: Is the cough dry or are you coughing up mucus? Patient: It's mostly a dry cough. Doctor: Does your chest hurt when you cough? Patient: A little. It feels sore, but I don't have severe chest pain. Doctor: Do you feel short of breath? Patient: No, I can breathe normally. Doctor: Have you taken anything for the symptoms? Patient: I took some medicine for the fever, but I haven't taken anything for the cough. Doctor: Are you allergic to any medications? Patient: No, not that I know of. Doctor: Have you been around anyone else who was sick? Patient: Yes, one of my coworkers had similar symptoms last week. Doctor: All right, I'm going to examine your throat and listen to your breathing. Patient: Okay. Doctor: Take a deep breath, please. And breathe out. Again. Inhale. And out. Exhale. Your breathing sounds clear. It may be a viral infection, but I'd like to check a few more things. Patient: Do I need antibiotics? Doctor: Not necessarily. Antibiotics do not treat viral infections. I'll explain what treatment is appropriate after the examination. Patient: All right. Doctor: For now, drink plenty of fluids, rest, and monitor your temperature. Seek medical help urgently if you develop breathing difficulty, severe chest pain, confusion, or rapidly worsening symptoms. Patient: Thank you, doctor. Good. That conversation included many useful phrases. Let's look at a few of them. I've been feeling unwell means you do not feel healthy. What symptoms are you having means what physical problems are you experiencing? Is the cough dry? A dry cough does not produce mucus. Are you coughing up mucus? Asks whether material is coming from your chest when you cough. Do you feel short of breath? Shortness of breath means having difficulty breathing or feeling unable to get enough air.
During a medical appointment, never pretend to understand something important. You can politely ask the doctor to repeat or explain. Use these sentences. Could you please repeat that? Could you speak a little more slowly? I'm sorry, I didn't understand. What does that word mean? Could you explain that in simpler English? Could you write that down for me? Let's repeat them. Slowly. Could you please repeat that? Could you speak a little more slowly? What does that word mean? Could you explain that in simpler English? Could you write that down for me? Excellent. You may also need to confirm instructions. You can say, so I should take this medicine twice a day? Should I take it before or after food? How many days should I take it? Are there any side effects? When should I come back? What should I do if the symptoms become worse? Do not leave the clinic, look at the medicine, and then ask the medicine bottle, so what exactly am I supposed to do with you? The bottle will probably not answer. Ask the doctor or pharmacist while you are there. Some health problems can wait for a regular appointment. Others may require urgent medical attention. Useful urgent phrases include, I'm having trouble breathing. I have severe chest pain. I feel like I'm going to faint. I'm having a serious allergic reaction. The pain is getting worse quickly. I need urgent medical help. Severe means very serious or intense. Faint means briefly losing consciousness. If you believe there is an emergency, contact local emergency services rather than waiting for a routine appointment. For less urgent problems, you can say, I'd like to make an appointment. I've had this problem for a few days. The symptoms are uncomfortable, but they are not severe. I'd like it to have it checked. This episode teaches language only. It does not replace professional medical advice. Now it is your turn. I will say a sentence naturally. Listen first, then repeat it after me. Ready? I've had a headache since yesterday. Again, I've had a headache since yesterday. My throat hurts when I swallow. Again, My throat hurts when I swallow. The pain comes and goes.
Again, the pain comes and goes. I feel dizzy when I stand up. Again, I feel dizzy when I stand up. I've been coughing for 3 days. Again, I've been coughing for 3 days. I'm allergic to this medication. Again, I'm allergic to this medication. Could you explain that more slowly? Again, could you explain that more slowly? How often should I take this medicine? Again, how often should I take this medicine? Excellent work. Now, let's try one longer sentence. I've been feeling tired, dizzy, and slightly nauseous since this morning. One more time. I've been feeling tired, dizzy, and slightly nauseous since this morning. Very good. Do not worry if you cannot repeat everything perfectly. Listen again later. Your ears and your mouth improve through repetition. Let's quickly review what we learned today. When the doctor asks, "What seems to be the problem?" you can answer, "I have," "I feel," "I've been having," or "I've been feeling." To describe time, use "for 3 days" or "since Monday." To describe pain, use words such as sharp, dull, burning, throbbing, aching, or cramping. You also learned how to say, "Could you repeat that?" "Could you speak more slowly?" "How often should I take this medicine?" and "What should I do if the symptoms get worse?" Remember, you do not need perfect English to communicate clearly. Use short sentences, give specific information, ask questions, and never feel embarrassed about requesting clarification. Before we finish, answer this question in the comments. Which medical sentence from today's episode was most useful for you? Write 1 or 2 sentences in English. For example, the most useful sentence for me was, "Could you explain that in simpler English?" Thank you for listening to Daily English. I'm Aranomi, and I'm very happy that you practiced with me today. Remember to like the video, subscribe to the channel, and share this episode with someone who is learning English. Keep listening, keep speaking, keep practicing, and keep becoming more confident every day. Take care, and hopefully you will not need to visit the doctor anytime soon. See you in the next episode of Daily English.